Doctors, do this to make ChatGPT work for you. We've all heard about ChatGPT and how it's going to change our lives. But for those of us in the medical profession, you may be thinking, will this work for me, or is this just more hype? Fear not. Tech Talk is here to walk you through the steps to make ChatGPT your superpower assistant. By utilizing ChatGPT in healthcare settings, we can access a wealth of medical knowledge, improve our decision-making process, and obtain a host of connected insights across many topics. Whether you're seeking information about medical conditions or treatment options, help writing documentation or notes, or even engaging in simulated patient interactions, ChatGPT has the potential to augment the expertise and efficiency of healthcare professionals like you. Here are some top tips for medical professionals who are learning how to prompt ChatGPT effectively, plus a mind-blowing game changer that will change the way even pros use ChatGPT. First, be clear and specific. When formulating your prompt, it's crucial to be as clear and specific about the information you need as possible. Provide as much relevant context and description as you can to help ChatGPT understand your query. Do you need your answer to be smart, honest, helpful, harmless? Do you need it to adhere to evidence-based best practice? Do you need it to never include common misconceptions, outdated information, fiction, myths, or memes? Then say so. Remember, ChatGPT is trained on the entire internet, not just true information. If you want it to limit its search to reliable sources, you'll need to condition it first. Use structured prompts. Instead of asking open-ended questions, consider using structured prompts, or even providing multiple choice options when appropriate. This can guide ChatGPT's thought process and increase the likelihood of getting a strong, focused answer. For example, if you're looking to explore the difference between the 2012 and 2017 diabetes clinical practice guidelines, reference them directly in the chat, so you can be sure to get a list of the answers you're looking for. Experiment with different phrasing. If you're not satisfied with the first response, try rephrasing your prompt or question. Sometimes, a slight change in wording can lead to more accurate or comprehensive answers. The medical field is one with lots of specific terminology and jargon. Don't be afraid to get technical with ChatGPT. The more specific the question you ask, the more nuanced the answer will be. Utilize context and follow-up questions. Incorporate relevant context right into your prompt to help ChatGPT better understand the specific medical scenario or problem you want to address. Additionally, if the initial response is not sufficient, ask follow-up questions to clarify or dive deeper into the topic. For example, the prompt, "What are the primary symptoms of congestive heart failure?" will provide a more high-level response than the query, "What are the acute symptoms of myocardial infarction as a result of congestive heart failure in a 65-year-old woman with comorbidities of diabetes and atherosclerotic vascular disease?" Provide constraints or guidelines. If there are specific constraints or guidelines that should be considered in the response, make them explicit in your prompt. This helps ensure that ChatGPT provides answers that align with the desired medical guidelines or ethical considerations. Validate answers with trusted sources. While ChatGPT can provide helpful information, always remember to validate the answers using trusted medical sources. ChatGPT is a powerful tool, but it's no replacement for human expertise and professional judgment in healthcare. Never, ever rely on ChatGPT alone to give you medical advice or insight. Remember, ChatGPT is pulling from billions of documents, not just vetted and validated evidence. Practice refining follow-ups. ChatGPT can use the context of what you've already prompted to continue its line of reasoning and give you additional information on the same topic. For example, if you ask ChatGPT about the top digital health trends and you see nothing about telemedicine, but you really think it belongs there, just ask, "What about telemedicine?" You'll be amazed at ChatGPT's ability to continue and refine its line of reasoning. Finally, here's an unbelievably powerful tip for healthcare professionals who are learning how to prompt ChatGPT effectively. Prompt as a specific persona or role. If you want ChatGPT to respond as if it were acting in a specific capacity, make that explicit in your prompt. For example, you can specify that ChatGPT should respond as a medical specialist, a nurse, or a patient. By doing so, you align ChatGPT's answers to the perspective, knowledge base, or expertise of that role. If you ask ChatGPT to present as a radiation oncologist, the quality of the answer you receive about an oncology patient will be light years ahead of a more general query. Remember to incorporate terminology, language, or jargon that someone in that role would use. By using domain-specific vocabulary, you condition ChatGPT to generate responses mimicking the communication style of that role. This can be particularly useful when you want ChatGPT to simulate a conversation between healthcare professionals, such as a peer-to-peer review, or between a clinician and a patient. Remember, while ChatGPT can mimic the perspective of a specific persona or role, it is important to use caution and never let AI override your own best judgment. The generated responses you get from AI should be used for exploration and learning only. Verify and validate the responses against real-world expertise and guidelines to ensure accuracy and reliability in clinical decision-making. Finally, here's a final freebie to give your queries that extra edge. Incorporate time-related information. When asking a healthcare-related question, be sure to specify the timeline or milestones you're thinking about. Clearly mention the relevant time period, such as days, weeks, or months, to provide context for the response. For example, instead of asking something general like, "What is the healing process for this condition?" you can make it more specific by asking, "What are the typical stages of healing for this condition within the first week?" Or, "After 2 months of treatment, what improvements are typically expected in the healing process?" By incorporating time-related information, you guide ChatGPT to focus on the specific time frame of interest. This can give you more relevant responses, as different medical conditions will have varying healing trajectories or milestones at different stages. Hope these tips are useful, and drop any others you found in the comments below. Be sure to hit subscribe.